The team has prepared a lot of more of case-based interactive session that will be useful with our everyday practice.
On behalf of FEU NRMF Medical Center, Department of Medicine, and all of the people around this program, I would like to extend a most cordial welcome to everyone.
And to all attendees, welcome to our 27th postgraduate course of the FEU NRMF Department of Medicine.
Remain inquisitive, remain asking questions, because from there we learn. Even if we're old, we're young and old alike, we always learn. Learning source, itong symposium na to. So, rest assured that we will do better. We will do our best for giving you the most or the best education that there is available.
Autoimmune diseases present with a wide variety of organ involvement, encompassing all IM, internal medicine subspecialties, and not just IM, even other specialties.
Job in his time was eyes to the blind and was feet to the lame. Si Job hindi naman doktor, na kaya niya yan. Siguro mas kaya natin.
For the first winner, Dr. Camille Estrada, are you here? Okay, we have one more. The next winner is Dr. Bob Dylan Pascual.
Claim her prize.
I have seen these specialists grow. Itong mga consultants natin ngayon na specialista na, they were once my resident o tumatanda na, di ba?
Now we are all geared for our next session. This session entitled The Case of CNS Lupus with triple positive antiphospholipid autoantibodies with concomitant infection.
Welcome to our first case discussion for this postgraduate course.
To discuss a case of a 25-year-old female, known SLE, presenting with seizures. To discuss issues related to managing SLE with antiphospholipid syndrome.
The span of time from the diagnosis of SLE up to the time the patient was discharged during her second admission.
We really have to look into the history of the patient. Probably the patient was sick at that time. We were not able to probe further into the family history.
Neurologic, it only identified seizure. It only included seizures and psychosis.
When you say seizure, on the other hand, it would be the abnormal electrical activity that happens in the brain that is detected during EEG. Okay?
Now, I'm tasked to talk about this one. So the title is Rashminat, Dermatologic Manifestations of a Connective Tissue Disease. In dermatology, when we see our patients, the lesions that are said to be very visible.
One of the most challenging clinical scenario in the field of medical oncology, and this is the coexistence of autoimmune with cancer.
We are presented with a 43-year-old female Filipino with a chief complaint of difficulty of breathing.
Ma'am, based on the history and initial findings, what is your clinical impression?
The patient presented with easy fatigability, shortness of breath, but it started 3 or 4 weeks prior to admission.
Autoimmune or Hashimoto's thyroiditis in elderly.
The elderly, we have this term as resetting po of the hypothalamic pituitary thyroid axis. Now, if your patient becomes hypothyroid, generally we don't treat the hypothyroid phase, we just observe the patient.
Primum non nocere. First, do no harm. Never forget, the more patient controls the disease, the less the disease will control the patient.
Don't take my breath away. A case of pulmonary hypertension.
So this is a case of a 50-year-old female diagnosed with valvular heart disease since 2005 and SLE since 2006, maintained on hydroxychloroquine and then also known hypertensive since 2014 on losartan and amlodipine.
I still believe this is most probably secondary to a rheumatic process rather than a cause of the SLE as the cause of your mitral.
Develop pulmonary hypertension from the systemic lupus erythematosus.
Here are the ones that are lighting up. These are the ones that gives you the granular appearance sa immunofluorescence. Kasi when you do a biopsy, you perform the usual light microscopy, immunofluorescence, and then the electron
So
microscopy.
for autoimmune hemolytic anemia, this is a classification criteria. Filipino patients will present with this type of condition.
Vitamin mineral supplementation products can play a key role alongside good diet and ample exercises. Cosmos Mind has demonstrated one of the many potential benefits outcomes of daily supplementation.
Sana, doktora, sagutin mo.
So if the main pulmonary artery is larger than the aorta, that is already a sign that there is pulmonary hypertension.
Hypertension, you expect that. But by echo,
So with that, given with that scenario of this patient, the severe mitral stenosis, the pulmonary hypertension.
The focus, or one of the focus of this lecture, is about how rheumatology, which is wherein autoimmune disease in particular, unifies or binds all IM subspecialties.
So for patients with lupus and seizures, syempre you must give your anti-seizure medications. However, based on our knowledge in your pharmacology, your anti-epileptic medications are very, very notorious for drug-drug interaction.
Of course, very important is immunosuppression. Given a patient with lupus, septic patient, but this patient needs your antibiotics. This lupus patient would need those immunosuppressants. So should you give or should you not give? So it's really quite hard for us to decide.
For the rheumatologists, the challenge is very challenging to treat because finding the balance between controlling the disease activity and the side effects of the immunosuppression. Too much immunosuppression could also lead to infection. And the drugs that we use are also toxic to the patient.
Rheumatology, as one of my mentors always tells us, is a very internal medicine subspecialty. Why? Because it encompasses not only just rheumatology, but most, if not always, subspecialty manifestations.
I am asking myself, because most of the papers would tell us that those patients who develop SLE, they might have an underlying family history.
SLE is often falsely accused of causing anything and everything that might happen to a patient subsequent to the diagnosis of SLE.
the SLE itself, or is it rheumatic in origin?
There's actually one more bigger trial that is coming out.
It is unfortunate that 60% of them, despite aggressive therapy, they don't.
Kind of hard, but we're always faced with those challenges that we have to really deal with.
Finding the balance and also the timing of giving immunosuppression.
Treating a patient always a challenge, and patients will definitely benefit from an MDT approach.
As doctors, we can always have an opportunity to do good to all. God be all the glory. Salamat po sa inyo.
Natutuwa ako, ang pinakamagandang regalo na binigay nyo sa buhay ko is makita ko kayong maayos. Maayos in terms sa career ninyo, sa buhay ninyo, sa pamilya ninyo. Yun lang ang regalong pwedeng ibigay ninyo sa teacher ninyo na nagtsatsagang magturo sa inyo. And hindi kami titigil na turuan yung mga kasunod ninyo, yung mas bata sa inyo, yung mga residente ngayon, sa pagtatrain sa kanila kasi FEU has produced a lot of consultant specialists that are worthy globally prepared kayo as consultants.